Doctor, should I get a CEREC crown or a regular traditional crown? If you're asking this question right now, you're probably confused. Because everywhere you look, some dentists say CEREC is the future. Some dentists say traditional is tried and tested. Some say same day is just expensive marketing. And you're just stuck in the middle thinking, I just want what's best for my tooth. Here's the truth. The answer is not, this one is always better. The answer is, which one is better for your specific case? And that depends on your tooth, your bite, your timeline, and what you're trying to achieve long term. I'm Dr. Deepti Melkote. I'm a certified micro-endodontist, and for over 17 years, I've been helping patients make exactly this decision. And today I'm going to give you complete clarity. I'll show you exactly how both options work, the real advantages and limitations of each, when I recommend CEREC, when I recommend traditional, and the one question you should ask your dentist before saying yes to any crown. Because the goal is not just getting a crown. The goal is protecting your natural tooth for life. Let's talk about it. Before we compare the two options, let me just quickly explain what a crown actually is. A crown or an onlay or an inlay is a protective cap usually placed over a damaged or weakened tooth. We usually recommend crowns when a tooth has had a root canal, there is a large cavity, a big old filling has weakened the tooth is cracked, or the tooth has lost significant tooth structure. The crown protects the tooth from fracture, restores function, and helps preserve it long term. So this is not cosmetic alone. This is functional dentistry. This is tooth preservation. Now let's compare your two options. First, traditional crowns. This is the method most people are familiar with. Visit number 1, we prepare the tooth, then we take an impression using impression material. Most patients do not love this part. Then we place a temporary crown. The impression then goes to a dental lab and then you wait, usually 1 or 2 weeks. Visit number 2, you return. We remove the temporary crown, try the final crown, adjust the bite and cement it. Sometimes a third visit is needed for refinements. This system has worked very well for many years, and in many cases it is still an excellent choice. Traditional does not mean outdated, it simply means lab-based. Now let's talk about CEREC. CEREC stands for Same Day Digital Crown Technology. Instead of messy impression materials, we use a small digital scanner. This creates a precise 3D image of your tooth. That digital model allows us to design the crown using specialized software right here in the clinic. We can evaluate fit, contacts, bite, everything in real time. Once the design is finalized, the crown is milled from a ceramic block inside the clinic itself. Right there, no outside lab, no waiting for days. In most cases, we can place the final crown the very same day. That means no temporary crown, no second appointment, no long waiting period. And this is why patients get very excited about CEREC. And honestly, for the right case, they should. Advantages of each. So what are the biggest advantages of each? Let me break this down clearly. CEREC advantages: 1 visit instead of multiple appointments, no temporary crown problems, digital precision over traditional impressions, same day protection for your tooth, often preserves more tooth structure. This is huge for busy professionals, elderly patients, people traveling, or anyone who simply doesn't want repeated dental visits. Traditional crown advantages: advanced aesthetic customization, complex multi-unit cases, specific material choices, high-end lab artistry, proven long-term track record. For example, some front teeth cases need advanced layering and characterization for the most natural appearance. That level of artistry is sometimes best done in a high-end dental lab. Certain full mouth rehabilitation cases may also benefit from a more detailed lab-driven workflow. Remember, good dentistry is not about forcing one solution. It's about choosing the right solution. This is what experience helps decide. Addressing common concerns. Now let me address the most common concerns. Doctor, is a CEREC crown strong enough? Yes, when properly selected and properly planned. Strength does not come only from the machine. It comes from the right diagnosis, the right preparation, the right material, the right bonding, and the right bite. A poorly planned CEREC crown can also fail. Technology does not replace judgment, it supports judgment. Doctor, is CEREC more expensive? Sometimes, yes, but here's what I tell patients. That's the wrong first question. The better question is, what are you paying for? You're paying for fewer visits, no temporary crown problems, speed, precision, predictability, faster protection for your teeth. You're also paying for time, and time matters, especially when delaying treatment increases risk. Sometimes patients compare only the treatment fee, but not the long-term value. Saving a tooth properly is always better than redoing failed dentistry later. That is where real value lives, not in the cheapest option, in the best long-term outcome. Patients often ask me, "Doctor, if it was your tooth, what would you choose?" And my answer is always the same. I would choose the option that gives me the best long-time result. Not the cheapest, not the fastest, not the trendiest, just the best. Because dentistry should never be based on short-term convenience alone. It should be based on preservation, longevity, predictability. Sometimes that's CEREC, sometimes that's traditional. There's no ego in good dentistry, only responsibility. The one question to ask, what is best for this tooth? Not what's trending, not what's cheapest, not what's fastest. What is best for this tooth, for this patient, and for this long-term outcome? That is one question that changes everything. So if your dentist has told you that you need a crown or an onlay or an inlay, do not just ask how much does it cost. Ask what's best for my tooth. Why are you recommending this option for my specific case? What are the long-term benefits? Because a crown is not just a cap. It is a protection for a tooth you may be trying to keep for life. And once a natural tooth is lost, replacement is always more difficult than preservation. Choose wisely. Choose long-term thinking. Choose the plan that protects your future, not just your schedule. Because the best dentistry is not about replacing teeth. It's about saving them first. I'm Dr. Deepti Melkote. Thank you for watching. If this helped you understand the difference between CEREC and traditional crowns, share it with someone who's facing this decision right now. And I'll see you in the next video.